Okay, we're going to go ahead and get started here. Please let me know at any point if the sound is not coming through okay, or the videos. We're going to go ahead and get started here to respect your time. So thank you so much for coming here today. I am not Dr. Dawson. I'm Dr. Buzanowska. I'm substituting for him today. And what I'm going to talk with you about over the next half an hour or so is regenerative medicine through Regenexx. And specifically, we'll talk about the shoulder, but this is applicable to any part of the body, as you'll hear throughout this session. So just a brief introduction of who we are. Some of you may know Dr. Dawson already. He is an interventional pain management physician, went to Tulane for medical school residency, did his residency and fellowship at UPMC, and he is certified in regenerative medicine through the Interventional Orthopedic Foundation. And this is myself. I went to medical school in Ohio, and I also did my residency at UPMC in Pittsburgh, fellowship in Philadelphia. And before joining River City, I practiced at the Cleveland Clinic, and I'm also certified through the Interventional Orthopedic Foundation in regenerative medicine. So when we talk about regenerative medicine here, you're going to hear the name Regenexx a lot, because this is the company that we are working with to deliver our regenerative medicine care. And the reason we partnered with Regenexx is because they have the longest history in really studying and analyzing and understanding regenerative medicine. They were the first ones to introduce stem cell therapy for orthopedic issues. And they have conducted the most research studies in one of the biggest research studies that showed safety of regenerative medicine for orthopedic injuries. They've delivered and they've created a lot of protocols that are very individualized and evidence-based for the best outcomes for patients. So it's really the best product out there. So we're working with them on our regenerative medicine side of the practice. Most people are interested in regenerative medicine because I'm going to excuse myself for just a second here. I'm sorry. Okay, I'm sorry about that. I'm back. So most people are interested in regenerative medicine because obviously some kind of orthopedic injury. So shoulder pain, back pain, neck pain, hip, knee pain. Either some people have been very active and got hurt. Some people developed issues due to just normal wear and tear, and over time the orthopedic problem has started to limit their function. And what they're looking for is something therapeutic, first of all, something that actually fixes the underlying problem without being cut on, without surgery, without sutures and cutting and replacing things, but in a more maybe organic way, still healing the underlying problem, not just putting on a Band-Aid on the issue. And our most important goal is obviously helping with pain, but also keeping people functional. And as you'll see throughout this talk, I'm going to show you some pictures of how people can really preserve their function, if not even improve function, after receiving regenerative medical care for their injury or pain or the condition they have. Okay. So the goal for this talk is to hopefully help you see how regenerative medicine through Regenexx is an alternative to the other option out there for your condition, for your problem. talk about whether you might be a candidate for it, and then help you schedule an appointment and talk to one of us about options for you. So once again, what are the current options in orthopedic care? So the current non-surgical options out there outside of regenerative medicine are steroid injections, physical therapy, bracing, chiropractor. We're all familiar with all those types of modalities. And they can be very effective for some problems and for some people. But what we find in our practice is that a lot of time we kind of hit a wall with those typical commonly available treatments. And there's a lot of people who were able to help, but then there's another large group of people that kind of get stuck with these modalities. On top of it, there is also a large group of patients for whom the conservative measures are actually contraindicated because maybe they develop side effects from medications, or steroids might not even be really indicated because of other medical problems that those patients are dealing with. So conservative care has a lot of limitations. Again, can be great for a lot of patients, but when you see enough patients, we see how much we actually get stuck with the limited options that we have through the conservative care. And in addition, what the currently commonly available options offer is really not something that will regenerate the problem, that will heal the problem if it's a structural issue. In those kinds of things, those kinds of situations is where patients get kind of shipped towards surgery. And as you may have seen from your experience, and you may also, we'll touch on it a little bit today, is that there are some problems that are clearly surgical, some problems clearly conservative, but there's a lot of middle ground where patients kind of get boxed into this or this, but in reality, they don't need or don't really benefit from either one. And the problem can actually be fixed and healed very holistically without, without being very invasive of surgeries or limiting ourselves to conservative measures that are kind of sometimes ineffective. So what is interventional orthopedics? The reason why we call this regenerative pathway that we use interventional orthopedics is because we focus on regenerative options, but for orthopedic problems. So rotator cuff tears, osteoarthritis of the joints, degeneration of the cartilage, labral tears, and things like that. So orthopedic type injuries, but using regenerative and interventional options. So all of this happens in very minimally invasive ways. So where there's no cutting, there's no taking anything out of you, there's no implanting anything, but we're still actually offering a fix to a structural problem. And therefore, we see this as an alternative to orthopedic surgery, but in minimally invasive ways. We counted that there's over 85 different types of injections and procedures that we can offer for orthopedic injuries through regenerative medicine. So as you have already heard from me so far, is that this option is for people who want to avoid surgery. Their condition is not clearly surgical, where something needs to be put together because it's broken or whatever, but it's in that middle ground where 75% of people fall, where it's like it doesn't have to have surgery, and it's not, what we're doing conservatively is not enough, and you don't want to go super aggressive, but you don't want to live with what you have. And you want to keep everything. You don't want anything cut on. You don't want to have anything taken out. You want to heal what's there already and use your body's natural healing strength and ability to heal the problem. Sometimes what we find is that surgical options, because they are invasive, they do involve cutting and in suturing, healing, replacing things, is that it does involve very lengthy rehabilitation time and downtime afterwards. And that's not the case for what we offer here. Some people want to avoid long-term medications and drugs because those things sometimes do have side effects. A lot of people actually already had surgery and they failed it, and they're like, so am I done? Is there anything else for me? And the answer is yes. Sometimes people seek regenerative medicine care because they've seen other people had bad outcomes with other options. Again, sometimes there's contraindications for surgery, and we make actually find that there's great options through regenerative care. Also, if you're young and you sustain an injury and you start going down the surgical route when it's not clearly necessary, that does have long-term repercussions and further problems down the road that through regenerative medicine you may not have to deal with. So we like to look at orthopedic care on a continuum. So there's people who may only need very simple injection or very simple therapy for their problem on one end of the spectrum, and on the other end of the spectrum, it's a very serious problem that definitely needs surgery. It's a real orthopedic serious issue that definitely has to be fixed, like a broken bone. But there's a lot in the middle. As you can see, these are just the extremes, but there's a lot in the middle where there's a lot of leeway and a lot of options available. And what you'll find in the community is that most people are very familiar with the simple injections, office injections, but the interventional orthopedic, very advanced type of care that we offer here, there's only 1% of physicians in the United States who are actually familiar with that. And it's because these are very, very highly advanced type of options. As kind of showing you here in these pictures is the complexity of our orthopedic anatomy. There's so many nuanced and small structures, from ligaments to tendons to cartilage to little bands of ligaments throughout our shoulders and hips and knees and spine, that in order for somebody to get the kind of training and understanding on how to diagnose these problems and all the options available to well properly treat it and how to perform the injections, it takes very, very highly advanced training and skills to go through all of this and really properly understand how to treat these problems. And part of also this is that the outcomes of any kind of treatment, but in particular regenerative treatments, is the ability to properly diagnose the problem. And oftentimes, if for practitioners in the community, if they're not really musculoskeletally trained physicians, then it's easy to just say it's arthritis or it's shoulder pain. What we want to do here, because of our background and our expertise and knowledge, is we don't want to just say this is shoulder or this is arthritis or torn labrum. We want to be very, very specific in understanding, well, where exactly in the shoulder, what part of the labrum, can we get there through an injection? What route do we take that for us in order to very clearly, specifically, and accurately get to the source of the problem? Because only then we can have excellent outcomes. So before we talk more about the shoulder, I want to tell you a little bit more about orthobiologics. And orthobiologics is another fancy word essentially for regenerative medicine type of treatments, but there's many different kinds. Orthobiologics includes treatments with concentrated platelets, which is where we take some of your blood and we select the part of the blood that contains specifically platelets. And platelets is the part of the it's part of the blood that's involved in our healing mechanism. So if you sustain any kind of injury, you cut yourself, you tear a tendon, or you bleed somewhere, it's the platelets that migrate to the injured part of the body and release all the healing mediators and chemicals into the injured, hurt part of the body in order to heal it. So we take advantage of it because that's already in us. That's already part of the amazing human body that we have that's able to heal itself spontaneously in some situations. In other situations, we have to assist it, but we can still use the natural healing power of our body to do that. Another part of orthobiologic care is where we actually use the growth factors and cytokines enriched serum. And that's where we break up the platelets and take out those growth factors and cytokines that are inside the platelets and break them up and deliver them to the injured part of the body. Another group of orthobiologic type care is stem cells. We use stem cells harvested from our bone marrow or adipose tissue. Those platelets are excellent for orthopedic purposes, easily accessible. We can get enough of them in a safe way. And then the last type of orthobiologics is the extracellular matrix type treatments. And we're not going to go into the in depth about that too much today, but we can talk about it next time. Here's Dr. Dawson performing a procedure, a regenerative procedure on somebody's back. For most patients, we don't have to go all the way to stem cells immediately. Most patients do very well with PRP or platelet-rich plasma care. And that's where, as I mentioned earlier, we take the platelets part of the blood and use that in various concentrations and consistencies, and we add other things like the growth factors and other things to specifically for each different kinds of different problems for best outcomes. But majority of patients really don't have to go all the way to stem cells right away. And there is a cost difference because obviously stem cells have to be harvested from bone marrow, so that's more invasive and more costly. And there's more steps involved with it, as I'll show you later. But again, that's majority of people don't need that. So what do we treat with Regenexx, regenerative medicine? And it's really almost everything. So this is an anatomical image of the shoulder. It shows you the joints, some of the joints that we have in the shoulder. Here's the AC joint at the top. Down here is the actual glenohumeral joint, the main shoulder joint. It's actually behind this muscle. You don't see it very easily. But any kind of actual arthritic joint conditions are appropriate for this. Bursa is down here underneath this bone, in between these two bones. It's a little cushion for the tendons that are sandwiched between bones to provide it with some protection. And when there are injuries and irritations and arthritis, the bursa can get very inflamed and can itself become part of the pain. So we can treat that as well. As you see, there's a lot of ligaments in the shoulder, and this is just a few of them. This image doesn't even show all of them, but there's a lot of ligaments, and those ligaments are made of cartilage, and they can get injured and torn and degenerated. They may not be as strong and supportive of your shoulder after an injury or related to age. Those things can also actually heal with regenerative care. Muscles can get also injury and tears and things like that, labrum. Tendons, we're only seeing a few tendons here. So here's the supraspinatus muscle tendon, and in this picture you see the tear. Here's the biceps tendon. Those are very commonly injured in the shoulder. Those are very appropriate for regenerative medicine. So what types of conditions? Again, partial tears of rotator cuff muscles or any other muscles around the shoulder are appropriate for regenerative medicine. Adhesive capsulitis is an inflammatory condition of the shoulder where it's associated with severe pain and inability to move. Loss of range of motion can occur in isolation or in conjunction with other issues of the shoulder that can also respond well to regenerative medicine. I talked already a little bit about osteoarthritis, very appropriate indication for this care. Tendinitis and bursitis, so irritation, inflammation, degeneration of the tendon without an actual tear, very appropriate for regenerative medicine. Labral tears. Labrum is an additional cartilaginous cushion that encompasses the shoulder joint to provide it with more stability. Can commonly get also injured. There can be tears in it, and that's when we lose some of the stability, and can be associated with a lot of pain, and can lead to recurrent dislocations because of the loss of strength of the ligaments and labrum and tendons. And sometimes some people are just more lax in their shoulders and they can sustain repeated dislocations, and we can help with that as well. So I'm going to hopefully play you this video. I hope this works, of Dr. Dawson performing a procedure.
Hello, Dr. Dawson again. We're going to do a Regenexx FDQ injection to the shoulder, one to the other joint, specifically the tendons have the tears in the AT joint and the bursa. So we're going to go ahead and anesthetize the patient using posterior approach on the ultrasound. And
that's well. That's big, yeah.
yeah. All right, we'll be back shortly.
This ain't no meaning to it.
Okay, and I apologize for the quality of the sound. It may not have been too good here, but hopefully you got some of it. And again, no cutting, no taking anything out, very quick and easy and pretty comfortable procedure to address the problem. Let's see, let me play 2 more videos for you. I hope you're going to enjoy it and find it useful.
The rotator cuff is a network of small and large muscles that help move the upper arm and stabilize the ball of the shoulder in the socket. Because of the joint's complexity and extensive range of motion, tears in the muscles or tendons of the rotator cuff are common and can lead to significant pain and weakness in the shoulder. Often these tears don't heal on their own. And because the shoulder is something that we rely on to perform most of our daily tasks, rotator cuff tears can be very frustrating injuries to live with. Recent research has shown that as we age, the local stem cells that would normally heal a rotator cuff tear don't work as well as they should. In addition, poor blood supply can also make tissues more fragile. Because of these factors, roughly 40,000 rotator cuff surgeries are performed in the United States each year. In this procedure, the surgeon sews the tear either through an arthroscopic opening or through an open incision. These surgeries require significant downtime and painful rehabilitation to regain strength and range of motion. Sadly, some studies show that 6 in 10 rotator cuff surgery patients don't fully heal afterwards. In fact, the U.S. government-sponsored investigation into healthcare quality recently reviewed more than 150 published studies and concluded that there was no solid evidence that rotator cuff surgery benefited patients any more than no surgery at all. But there is good news for those suffering from a rotator cuff injury, and it doesn't involve surgery. Regenexx utilizes your own stem cells to help repair rotator cuff tears, using a minimally invasive and ultrasound-guided injection precisely into the torn areas of the muscle and tendon. The results from our treatment registry show that more than 70% of patients who received the groundbreaking Regenexx rotator cuff procedure noted improvements of 70% or more. In our clinical experience, Regenexx patients benefit from a quicker recovery and can get back to doing the things they love faster than those who undergo traditional surgery. So if you or someone you know has a rotator cuff injury, consider Regenexx, the non-surgical alternative that uses the healing power of your own stem cells to put you back on the path to an active and pain-free lifestyle.
Get back to our presentation. So, surgery is not always the best option. And again, this is really alarming. There's so many shoulder surgeries, especially for rotator cuff, being done. And this US government-sponsored study showed that this evidence for that is really very questionable, while the studies and registry from the Regenexx network of all the physicians doing very trained providers doing procedures for shoulder injuries and rotator cuff showed 70 to 88% recovery from regenerative medicine. So this is really groundbreaking. And another, I'm going to show you this other video where you'll see that truly through regenerative care, our body injured structures can actually heal.
I'm going to outline the supraspinatus portion of the rotator cuff, and any of the white in there means that the rotator cuff is damaged and torn. It should look like what's inside this box over here as very dark, but you see over here inside those lines, it's got all these white patches, and all those white patches are tears. Now, we did a precise high-dose bone marrow concentrate or a same-day stem cell injection procedure under ultrasound guidance into that area. And you can see that he now has much less white, certainly the patchy white in the middle.
And I am going to try and get this video differently because it's not okay. I think now we're going to be able to see both sides.
So it looks like on the MRI he's got some healing. Now, so we can look at the MRI all we want, but what's really the determination of whether this guy actually healed? He sent us this video of his 20-month result, 20 months after the procedure. So that's 370 pounds. So I think we can take it as evidence that he had a full recovery of his rotator cuff tear without surgery. Thanks so much for watching and have a great day. So it looks like
I'm going to go back to this part of the video we're on the left side of the screen, we're seeing all these tears in the rotator cuff muscle. But 6 months after the injection, there's very little of it noted on MRI. So we have evidence, MRI evidence of actual structural healing going on. Does take some time for us to see on imaging the actual healing. Pain relief comes much sooner than that, but we actually can confirm that regenerative treatments, when done properly, the right medicine, the right amount is injected in the right place. That's key. That's absolutely key to any good outcome. But when all of that is done well, then we can see that the muscle can actually heal. Okay. So let me see if I can move this bar from the top so you can see the name of the slide. But so what outcomes can we expect from regenerative medicine for shoulder issues? And Regenexx collects outcome data for all procedures that are performed, which means that every patient who has a procedure done is being evaluated 1, 3, 6 months, 1 year, up to 6 years out to see if they're actually improving with it. And from thousands of patients' data, what we're seeing, and this is data from this year, is that 88% of patients report improvement in function after Regenexx procedure for a shoulder issue. Pain in itself, excellent outcomes for pain relief. So in this particular study, what we're seeing is that at the time of the procedure, average pain was about 4.2. 6 years out, these patients have minimal pain. Again, the pain relief is noticeable even 1 month out. But the important thing is that it actually persists years out, which is fantastic, really amazing for pain medicine, being a pain doctor, knowing that I can do something that really heals issues and helps people years out is such a wonderful thing. And then overall shoulder improvement, again, there's probably nothing out there that's as effective as this. On average. So initially amount of improvement 1 month, 33%, but 3 months out, 50%, 1 year out, 60%, out 6 years out, still around 76% improvement years out. So very, very encouraging. And so what is it about Regenexx? What is it about the specific way that we perform these procedures that's different than some of the things you may see elsewhere in the community? In one of the very different approach type that we take with regenerative medicine is that we don't treat just one problem at a time. This is something that we have to sort of unlearn, going through medical education training and going through the traditional insurance model. We're only allowed to treat one thing at a time. But because with regenerative medicine, we don't have to follow the insurance, what insurance tells us to do, we can do things in ways that we think makes a lot more sense medically, which is that most of the time, it's not just one single problem that's causing the issue. And oftentimes we have to look above and below the injured area and see how other parts of the body, is it the mechanics, is it something coming from the spine that contribute to the problem, and assess and treat it all. Because if we only focus on one issue and we miss other things related or other things that maybe even we're at the root of the problem, then we're still not really going to get anyone better. And again, as I already said a few times, is the only way to have such good outcomes is because we are very, very thorough at understanding the underlying problem, being coming up with a very accurate diagnosis in treating all of the problems, not just one or one at a time, but treating everything. So we look at joint stability, but also the entire kinetic chain. So for a shoulder problem, we look at the neck, look at the elbow and arm. We may even look at the trunk, look at the shoulder blades, scapula. What's the posture? How is all of this putting abnormal stresses on the shoulder, and how are all the other things affecting the problem? So you may have a rotator cuff tear, but you may also have a pinched nerve in the neck. You may also have a chronically weak muscles in the back of the neck. And all of this, if we don't take care of everything, then the rotator cuff tear is going to maybe heal temporarily and then come back, maybe re-injure again. And we don't want that, because we really want those excellent long-term outcomes. The other important difference about Regenexx and how we practice regenerative medicine is what the company calls lab platform. Lab platform is essentially a fancy name for the fact that no two people get the same regenerative treatment. We have a lab, an actual lab, where we process the blood and process stem cells and everything that we do. And we look at the problem. We look at the severity of the problem. What kind of problem is it? Is it a joint? Is it a muscle, tendon, labrum? Where is the problem? How many issues are we dealing with? Are we dealing with a lot of neck related problems as well? Are we dealing with some kind of nerve compression as well? And each one of these issues may need to be treated differently. In addition, every person is a little bit different. Based on age and gender and functional status and other medical comorbidities, everybody's a little bit different, and everybody needs a little bit different approach. Lab platform is what allows us to process the platelets and product and everything, and achieve and get the dosages and concentrations different for different problem and different people. That is not something that's done anywhere else. Literally in every other type of regenerative practice that I know of, that I've ever heard of, is where everybody will get kind of the same exact thing for different problems, different part of the body, different conditions, different people. And that is not how we get good outcomes, because everything is dose dependent and everybody's different. And what we found through the registry is that different types of problems require slightly different approaches, slightly different concentrations, slightly different product. As I said earlier, in the different kinds of orthobiologic products, we have different things to choose from, and different problems will need different solutions. And this is where we get that information, is because of the data and registry. The registry has results from 20,000 patients that have had regenerative treatments. And that is how we know what works for what problem, because we collect the data, and then based on the data, we tweak the practice. So if we find out that this particular protocol doesn't work for this problem, we tweak it and we change it so that we know what works best for different problems and different people. And there's also ongoing research. So not only we publish and collect clinical outcomes, but we also continue research to understand in depth why does it work? How does it work? What do we need to do to make it work even better? So there's ongoing research studies and protocols and things going on that continuously help us learn more. All our procedures are done with imaging guidance, and the imaging can be multiple modalities. As you saw in the video, Dr. Dawson was using ultrasound. Sometimes we use ultrasound guidance in conjunction with X-ray guidance, but that is what allows us to be very precise in where we're going with the procedure, with the injection. If we assume that we're going to get to the right place by blindly placing the needle, we will likely be wrong about that. And again, our outcomes depend on the accuracy of what we do. So that is why all our regenerative procedures are always done with imaging guidance, so that we are 100% sure that we're going the right place. And then the dosing part, which is where I talked about the lab platform. We count cells. We know what dosages are optimal for what problem, what type of condition, and that is how we can really individualize and personalize treatment for everyone. And again, unless you are a musculoskeletal physician, trained not only in musculoskeletal care, but then additionally trained in regenerative care, there's no way to know how to do this well. So a typical visit for a PRP procedure, for PRP consultation, lasts about an hour. If the a patient proceeds with this, we draw blood, there's an injection, and then afterwards there's often some kind of rehabilitation process involved with this, and then follow-up visit. For a stem cell type procedure, again, we evaluate everyone for at least, there's a full 1 hour evaluation, and then this is a little bit more involved, where before we actually inject the stem cell, we first inject what we call something to till the soil, so some kind of growth factors or PRP to prepare the area for the stem cells to be able to survive and thrive and turn into the kind of cells that we want in order to regenerate the tissue that's that needs to be healed. That day 2 is what we call plant the seed, so that's when we inject the stem cells. And then the third day, we let the stem cells kind of sit there, get in there, start to take effect, and then day 3 we follow up with another injection to give the stem cells a little bit extra boost to grow further. And then there's also a rehabilitation afterwards to help stimulate blood flow and help strengthen muscles and move the area. Rehab after the procedure is on average 60% less intense and long than any kind of surgery. Typically, a specialized physical therapy is needed to restore neuromuscular balance because of the approach, the philosophical approach that we have with this. We don't focus just on one area, one problem, because we focus on the entire kinetic chain. We work with therapists that know how to do this, how to assess and treat the other structures that are involved with a particular problem. Oftentimes, physical therapy may not be needed or may not be needed immediately afterwards. And that, again, depends on the particular problem that we're dealing with. And I'm going to finish up with a few notes that this is very, very safe, okay? The most common problem is pain. And pain is expected because with this procedure, oftentimes you want to reawaken your own inflammatory reaction and immune system to reignite the healing process. So the most common problem we see is some kind of discomfort or even pain after the procedure. We do provide pain medications to help with that time, but otherwise it's very, very safe. Some, in terms of how this is paid for, there are some insurers that do pay for this procedure. Some companies, but conventional health insurance companies do not cover Regenexx. And let me move this bar again out of the way. Okay, but it can be somewhat costly depending on how aggressive we get with these, from a few $100s to a couple $1,000s to stem cell treatments are the most expensive, from $5,000 to $8,000. And okay, I'm going to leave some time for questions and how to schedule. I'm going to just leave this for a minute to let you know that we will have other webinars coming up where we're going to talk specifically about the spine, hip, knee, sacroiliac joints, elbows, feet, and so on. But here's how you can contact us, and or email if you want to schedule a consultation or you want to more know about what we do.